Welcome to the New York Methodist Hospital Patient Education Series for Surgery. This DVD will provide you with valuable information on what to expect before, during, and after surgery. We understand the anxieties of having surgery, so New York Methodist doctors and staff work with you in advance to plan each step of the process. You'll know exactly what to expect, from pre-surgical testing to post-surgical rehabilitation, and we tailor the program to your unique health needs. You can also alleviate any pre-surgery jitters by being an active participant in decisions that affect your health. Ask questions, communicate concerns, and clarify your understanding of any directions your doctor gives to you. The information in this DVD serves as a guideline only and does not replace the instructions given to you by your doctor. It's best to discuss your specific health needs with your doctor and follow his or her directions accordingly. Healthy joints, such as the knee or hip, are necessary to exercise, play sports, and simply walk. Over time, our joints may become damaged through normal use, traumatic injury, or even disease. Luckily, doctors can perform total joint replacement surgeries designed to restore a person's active lifestyle. A joint is where two or more bones make contact. In the knee joint, there are two such places where the thigh bone, or femur, meets the shin bone, and another where the thigh bone meets the kneecap. The knee joint is the largest and most complicated joint in the human body. It supports nearly all of our weight, which means it's most vulnerable to injury and osteoarthritis. In some cases, the cartilage or elastic cushioning in the knee becomes torn or worn out and must be replaced to make the joint function correctly. In total knee replacement surgery, your surgeon removes the damaged cartilage and bone and replaces it with metal or plastic joints, which restore alignment and function to your knee. The hip joint, also called the acetabulum, is where the head of the thigh bone meets at the socket of the pelvis. Its primary function is to support the weight of the body in standing, walking, and running. We have two hip joints, sometimes called ball and socket joints, one on each side of our bodies. To repair or replace a damaged or diseased hip joint, an incision is made, and the head of the thigh bone and socket are removed and replaced with metal and/or plastic. The implants are inserted into the pelvis socket and femur. With your new hip joints, you will soon get back to doing all the activities you and your family enjoy. Osteoarthritis is a degenerative joint disease which affects the cartilage lining on the ends of bones. In essence, the cartilage becomes worn, no longer allowing smooth movement inside the joint. This causes a person a grinding sensation which results in pain, stiffness, and loss of function. Osteoarthritis is the main reason total joint replacement surgery is a necessary treatment. When your orthopedic doctor diagnoses you as needing joint replacement surgery, relax. Joint replacement surgery, or JRS, is a successful, proven treatment that restores a person's mobility. At New York Methodist Hospital, we perform these procedures on hundreds of people each year who post-surgery return to full and active lifestyles. But, as with any surgery, there are things you will need to do before, during, and after to prepare your body, mind, family, and home. To ensure a complete recovery, we urge you to adhere to the following guidelines very closely and become an active participant in your health care. Follow your doctor's directions and partner with your healthcare team to discuss insurance issues, review options for rehabilitation, and prepare for pre-surgical testing and admission to the hospital. The first thing you will need to do is arrange for a visit with your primary care physician prior to surgery to assess your general health condition. Be sure to handle any dental work well in advance of your scheduled surgical date. After your visit with your primary care doctor, create a master medical history by listing all your medical conditions and surgeries, all your medications with exact dosages and frequency, and any allergies or negative reactions to medications or anesthesia. If you are taking any pain relievers such as Motrin, Advil, or others, you must stop taking these medications 7 to 10 days prior to surgery under the direction of your doctor. If you are taking aspirin, Plavix, Agranox, Coumadin, or other blood thinners, you must notify your physician and pre-admission nurse as soon as possible. If you are on any diabetic medication, be certain to discuss any adjustments to your dosage during and after surgery with your primary care physician and surgeon to formulate a plan of care. After surgery, your care will be focused around several weeks of physical therapy. Therefore, be sure to work closely with your insurance provider to ensure that your benefits will cover the rehabilitation program of your choice. You can find a list of rehabilitation programs on the New York Methodist website. Select a family member or close friend to act as your coach or buddy before, during, and after surgery. Your coach will be the primary contact person to receive information from the healthcare team and should attend pre-admission visits at the hospital with you. He or she will be educated to assist you with recovery and rehab and should be available for about 2 weeks after surgery to help you with exercises and other needs. As with any surgery, there are risks, so it's wise to have legal issues in order before undergoing major medical procedures. This forethought ensures that your family is able to make decisions for you should the need arise. Make sure you have a living will or durable power of attorney, as well as a healthcare proxy. Our social workers can advise you on where to acquire these documents if you do not have a personal attorney. To aid in a speedy and complete recovery, you should create a safe and welcoming environment before your surgery. Remove all throw rugs out of your main walking paths. Move essential items to areas where you can easily reach them. Widen pathways throughout your home to make easy passage while you are using a walker, but do not rearrange furniture. Your home should be as familiar to you as before your surgery, just adjusted to accommodate your recovery. One way is to increase chair and bed heights about 2 inches above knee height. And don't forget to prepare and freeze nutritious meals ahead of time so they are on hand after your discharge from the hospital. It will be important to bring the following items with you when you check into the hospital for your surgery: the New York Methodist Patient Guidebook, copies of advance directives, insurance cards, loose, easy-to-wear clothing, a pair of comfortable, well-fitting shoes or sneakers with non-skid soles, personal care items such as a hairbrush, denture case, toothbrush, or eyeglasses. If you have sleep apnea and wear a CPAP, bring only the mask, not the machine. Do not bring with you to the hospital credit cards, large amounts of money, valuables, or jewelry. You won't need any of them during your stay. A few days before your surgery, you will need to come to the hospital for pre-surgical testing. During this part of the process, we will review your medical history and medications and perform various tests to ensure that you can safely undergo the surgical procedure. As the day of your surgery arrives, there are still some important steps you will need to take to continue to prepare yourself. You should shower the night before and the morning of surgery with chlorhexidine, provided to you by New York Methodist Hospital. Ladies should not shave legs the day before or day of surgery. There are dietary restrictions you will need to follow as well. Do not eat or drink anything after midnight the day before your surgery. This includes not drinking water, chewing gum, or eating any sucking candy. A representative from New York Methodist will call you the evening before surgery or Friday if your surgery is on a Monday and tell you what time to arrive at the hospital. Let your physician's office know if you need an ambulette or if you are taking Access a Ride. On the day your surgery is scheduled, there are many administrative details we need to accomplish, and your help is critical. Before you leave home for the hospital on the day of your surgery, take any morning medications that you were instructed to take with only a sip of water. Please arrive at the hospital 2 to 3 hours before your scheduled surgery time and report to ambulatory surgery. It will be important to have your coach or buddy with you at this time to facilitate paperwork and answer any questions on your behalf. After your paperwork is complete, you will be taken to our pre-operation unit, or pre-op. While there, a New York Methodist staff member will prepare you for surgery. You will be changed into a hospital gown and have a name band placed on your wrist that will remain in place during your stay at the hospital. You will then be taken to the pre-op holding area, where a surgeon will mark the operative leg and obtain all necessary consent forms. While you are in the pre-op unit, your anesthesiologist will visit with you and speak to you about your medical history and review what options you have for pain management. It is required that you have either a spinal or general anesthetic administered before your surgery. Please check with your primary care physician or surgeon prior to surgery about which method is best for your particular case. As you await surgery in the pre-op unit, you will first have your anesthesia administered and then given antibiotics within 1 hour before surgery starts. In addition, a catheter will be inserted in your bladder to drain urine during the surgery and immediately after. Once you are brought into our state-of-the-art operating rooms, the length of the surgery varies from between 2 to 3 hours. With you will be a full team of doctors and nurses to assist your surgeon with every aspect of the procedure. Once your surgery is completed, you will be brought to the post-anesthesia care unit known as the PACU, where you will be closely monitored until you are fully awake. While you are recovering from the anesthesia, your surgeon will speak with your family and coach in the surgical waiting area to apprise them of your condition. As you awaken, you can expect the following: oxygen for your nose, a blood pressure cuff on your arm, a pulse oximeter on your finger to monitor the amount of oxygen in your blood, a catheter in your bladder, a catheter in your back or leg for pain, a surgical bandage on your incision. Feel free to request pain or nausea medication if needed from the nurses on duty. Once you have fully recovered from the effects of the anesthesia, you will be taken from the PACU and placed in a hospital room. There, our staff will monitor your vital signs closely, manage your pain, and instruct you on how to use a device called an incentive spirometer, which helps with airflow into your lungs. They will also teach you daily strengthening workouts for your joints and muscles. It is possible that some patients may spend the first night after surgery in the PACU, but in either case, you can expect that overnight you will continue to be given oxygen, be given IV fluids to keep you hydrated, and have a catheter in your bladder to drain urine. All this is normal, and throughout you are kept as comfortable as possible. Joint replacement surgery is a safe procedure, and the outcome of most patients is wonderful. Although the risks for joint replacement surgery are low, there are potential complications associated with any surgery. It is important to understand these risks before you proceed. Potential complications associated with joint replacement include blood clots, infections, stiffness, pneumonia, implant loosening, failure, or dislocation, and rarely, damage to adjacent nerves and blood vessels. Finally, over a period of time, a joint replacement can wear out. There are several things that our staff and you can do to prevent any post-surgical complications. The most common occurrence is blood clots. You will be given blood thinners such as Lovenox and Arcumidin. Plus, you will need to wear special boots to promote circulation. You will also need to have your legs exercised as soon as possible post-surgery to discourage blood clots from forming. Our staff will help you with this. Pneumonia is another serious post-surgical complication. Our staff will monitor your breathing and work with you to cough and practice deep breathing exercises. Infection is always a danger for people who have just undergone surgery, but at New York Methodist Hospital, we create an environment that significantly lowers your risks of infections. More minor post-surgical complications can include nausea, constipation, and swelling. Our staff is sensitive to your needs to prevent and treat these uncomfortable conditions and offer medications as needed, including a daily stool softener or laxative and frequent ice therapy to keep swelling to a minimum. You can expect to be in the hospital for, on average, 3 days after surgery. However, even before your discharge, New York Methodist staff will work with you to plan out all the steps in your recovery process. First, our physical therapist will instruct you on transferring, walking with a walker or crutches, strengthening exercises, stair climbing, and review precautions. Then, our occupational therapist will offer you self-care activities and the use of therapeutic equipment. Our team's goal is for you to reach your maximum level of independence before you leave the hospital. But remember, it is essential to the success of your joint replacement surgery for you to participate in your post-surgical therapy and rehabilitation. If you have any personal questions about your recovery, such as diet, sexual activity, and weight issues, you can confide in your New York Methodist therapist. They are trained to answer your every question. Because each patient's recovery is different, your progress and readiness for discharge will be assessed daily, and your case manager and/or social worker will visit you the day after surgery to see how you are doing. Later, they will discuss with you the discharge plan, assist you with insurance questions, and make arrangements for home medical equipment. You can be of help to your case manager by researching rehabilitation programs in advance and choosing one that is covered by your insurance. You will certainly be happy to return home, but there are a few simple rules to follow to ensure the full success of your operation. You must keep your incision clean and dry. Do not shower until the staples are removed, which happens about 14 days after surgery. You can use a waterproof dressing if necessary, but check with your physician. It is ideal if you wait at least 6 weeks before driving a car, but a lot will depend on your driving habits and what type of transmission you use, so again, check with your physician. Air travel presents its own set of challenges after surgery. If you don't have to fly, then wait at least 6 weeks before traveling. When you do fly, you will need an aisle seat and try to exercise legs hourly to promote blood flow. And be aware that your new joint may set off metal detectors at the security checkpoint, so we advise that you travel with hospital paperwork as proof of your surgery to save time and avoid questions from security. It is advisable to wait at least 6 weeks after surgery to visit your dentist. Be sure to inform him or her that you have a joint replacement. It is possible you might need to take antibiotics before your appointment, so check with your dentist or surgeon on this matter. In addition to the various medications and physical therapy you will need to follow after your surgery, there are several important precautions to take. Those people with knee replacements can reduce knee stiffness and speed recovery by avoiding squatting, twisting, and kneeling directly on the new joint. To reduce pain, you can also place a pillow behind the knee for 6 weeks following surgery. Those with hip replacement surgery require special treatment for about 2 to 3 months after surgery. Before getting out of bed each day, pump your ankles by moving your feet and toes up and down about 10 times. Do only those exercises taught you by your therapist and gradually increase the number of sets you do as you get stronger. Following these rules will help reduce your risk of hip dislocations or bone growth into your new joint while healing soft tissue and strengthening muscles. In addition, depending on whether you've had an anterior, front, or posterior, rear hip replacement, there will be special rules to follow in terms of sleep positions, crossing legs, and bending. It is important to check with your physical therapist to review what will be best for you and never attempt an exercise not prescribed by your instructor. We hope that the information in this video has been helpful in preparing you for your surgery. You've made an excellent decision by choosing to have your surgery at New York Methodist Hospital. Our surgeons and staff have the expertise and dedication to make your surgery and your stay with us a positive one. We look forward to answering any other questions you may have.